Kearns-Sayre Syndrome, also known as KSS, is a rare disorder that affects the tiny power plants inside our cells called mitochondria. It usually appears before a person is 20 years old and leads to problems with eye movement, heart rhythm, and muscle strength. Think of it as a childhood condition where the eyes cannot follow a moving object like a ceiling fan because the eye muscles become weak. KSS is caused by missing pieces of mitochondrial DNA. Mitochondria need the full DNA code to make enough energy. When a chunk is deleted, the cell's factory loses a key part of its assembly line, so muscles, eyes, and the heart receive less power. This loss often happens spontaneously and is not inherited from the parents. The most common signs are progressive external ophthalmoplegia. Eyes cannot move outward, leading to double vision or difficulty reading. Pigmentary retinopathy, a change in the back of the eye that makes night vision poor. Heart block, an irregular heartbeat that may need a pacemaker. Muscle weakness, hearing loss, and sometimes endocrine problems. Imagine a teenager who cannot look up at a chalkboard, gets tired after climbing stairs, and hears a faint beep from a heart monitor. Doctors diagnose KSS by looking at symptoms, doing eye exams, ECGs, and sometimes a small muscle biopsy that shows mtDNA deletions. Genetic tests can confirm the DNA missing piece. There is no cure, but treatment focuses on managing each problem: eye patches or surgery for vision, a pacemaker for heart block, physical therapy for muscles, and supplements like coenzyme Q10 to help mitochondria work better. Because the DNA deletions happen spontaneously, there is no way to prevent KSS before it starts. Families can receive genetic counseling and avoid drugs that stress mitochondria. For example, certain antibiotics or high-dose valproic acid, similar to keeping harsh chemicals away from a delicate power plant. New research is trying to repair or replace the faulty mitochondrial DNA. Experiments with gene therapy delivery drones that drop healthy DNA into cells, and drugs like alamipretide or NAD+ precursors that boost mitochondrial energy, have shown early promise in small trials. Scientists hope these advances could improve energy production for KSS patients